Warmer weather means more time outside being active, but if you suffer from knee pain, you know your daily activity has limits. I met up with Dr. Robert Greiner, an orthopedic surgeon with St. Mary's Medical Center, to find out the advantages of robotic knee replacement surgery. That in this Aging in Style. How do you know if robotic surgery is right for your knee?
Well, robotic surgery involves replacing the knee joint using robotic assistance. And so if you've been through a lot of the trials and tribulations of injections, you've tried weight loss, diet, things like that, robotic surgery will decrease the amount of pain you have by replacing your joint with a metal and plastic construct and giving your life and activities back.
Can you explain what a robotic knee surgery is?
Sure. Robotic knee surgery actually uses several trackers to monitor your leg in space. It also uses a head array that keeps an eye on your knee. We can replace that utilizing a specialized handpiece that the doctor controls in order to get the knee replaced in a more precise manner, taking off just the exact amount of bone needed to replace it with the implants provided.
Okay, and why is this maybe a better treatment plan or a better surgery than a traditional knee replacement?
Traditional knee replacements have been done for many years, but there are ways to improve upon that. As we kind of get new technology and new improvements in technology, we're able to find better ways to precisely align the knee implant to give you better longevity. It lasts a lot longer. It also gets it more precisely aligned so patients can walk more normal.
Now let's take this on the flip side, because as we age, you may have to make certain lifestyle changes or take certain steps so that you're able to remain active.
Certainly, a lot of the steps you can take before you need to see me and get your knee replaced is weight loss management, management your health, staying active and doing some exercises, keep your muscles strong. We also find people do a lot of anti-inflammatory treatments to help out prior to getting their knee replaced.
Okay, and when you talk about anti-inflammatory treatments, is that something you offer, or what are those?
Sure, so you can get over-the-counter medications, but we do offer prescription medications. We do injections of medications as well. We can also offer stem cell treatment to try to alleviate a lot of their concerns. But once you need the robotic surgery, we can discuss that in great detail and get you on a plan that will be best for you.
Okay, and then if somebody is experiencing some of those issues with their knee, maybe they're working out, maybe it's just in your daily routine, what steps do they need to take?
I think a lot of the steps usually are try to work on your own health, discuss with your primary doctor about ways you can get back to a healthy lifestyle. If you are already healthy and doing activities but have injured yourself, come and see me, we'll evaluate your knee, take x-rays, do different kinds of workups to see if we can find a cure. Okay,
and when you talk about a healthy lifestyle, are there any baselines people should really start at if maybe they don't know where to start?
Certainly, and non-impact aerobic activities are good to do. Elliptical machines, if you can take up biking, it's a lot better on your knees than running, especially at an advanced age. Wear good, comfortable shoes, and make sure you stretch out prior to doing a lot of those activities.
Well, good tips there if you're leading an active lifestyle. Now, don't miss out on Dr. Greiner's seminar on Navia robotic assisted knee replacement. The presentation is not in person. It's through WebEx July 29th at 6 p.m. Register by calling Jennifer Walker at 816-655-5625 or go online at stmaryskc.com/events.